Hello, my name is Christina Grafe, and I'm going to speak about delivering culturally competent care. This is Zach, he's a paramedic, and this is Amanda Young, she is an ER nurse. So what is culturally competent care? Cultural competency in healthcare, it's kind of a broad concept. It's used to describe a variety of interventions that aim to improve accessibility and effectiveness of healthcare services for people from many racial and ethnic backgrounds and minorities. In nursing specifically, it can be an area of study and a practice. It focuses on concepts of holistic culture, health, illness patterns of people with respect to differences and similarities in their cultural values, their beliefs, their life ways, and the goal is to provide culturally congruent, competent, and compassionate care. Why is cultural competence important? Recent statistics from the United States Census Bureau in 2012 report that 12.9% of the population are foreign-born. 33.1% speak a language other than English in their home. As the U.S. population becomes increasingly diverse, it's important that nurses and members of the healthcare profession are prepared to give effective and quality care to patients of many different cultures and minorities. There's some necessities of cultural diversity. One needs to be aware of oneself. They need to do like a self-examination, be aware of what their culture is, why it's important to them, so they can understand why other people's culture might be very important to them. You need to be knowledgeable, obtain education and sound information about diverse ethnic and cultural groups. This doesn't include biases and stereotypes, which many healthcare professionals kind of fall into. You also need skill. It's the ability to collect cultural data about a patient's problem in order to perform an accurate, culturally based physical assessment. So their culture can affect their physical assessment many times. Encounters, encouragement of healthcare professionals to engage in cross-cultural encounters. The more encounters you have, the more experience you get, the more knowledge you gain about different cultures and minorities. And lastly, the desire. You need motivation. Healthcare workers need to be culturally aware and educated and involved with diverse encounters, but they have to want to do it. You can't make someone be aware of other cultures and minorities if they don't want to. Some examples of culturally competent care. There's three main ones that are pretty much in every culture or minority. Communication is many times different. In a lot of cultures, they don't speak English. Oftentimes, there's a language barrier between the healthcare professionals and the patient. Interventions to decrease this barrier helps to increase patient understanding and satisfaction. If you can't understand the patient, how are you going to do an accurate assessment? Spirituality and religion. Diverse cultures are associated with various religious beliefs. Some cultures may have different religious practices. For example, Jehovah's Witnesses, many of them don't want to have blood product transfusions just based on their religion, and we need to respect that. Diet. Awareness of possible differences in diets is necessary. Some cultures may have restrictions on certain foods. For example, people in the Islamic culture often do not eat pork. It's better to not assume that they have restrictions, but just inquire. Just simply inquire about a patient's diet and ask them if they have preferences. It displays cultural sensitivity and improves patient care. The culture I'm going to talk about specifically today is the Hispanic and Latino culture. According to the U.S. Census Bureau in 2010, there's 308.7 million people residing in the United States. 50.5 million people are Latino. That's 16%. And from 2000 to 2010, the Hispanic population increased by 15.2 million. So they're the fastest growing population in the United States right now of the minorities. As the Hispanic and Latino populations increase, healthcare professionals will continue to see a proportional rise in the culturally diverse patients. Hispanic cultural influences, a few aspects of this culture, probably the biggest ones that will affect healthcare are their family, their religious beliefs, communication, and health beliefs. First off, the Hispanic family. The Spanish word La Familia means family. It's a strong piece of the Spanish community. The family is often considered more important than the individual or the community. Why is this important to healthcare? Family may assist with making important critical health decisions. Respect must be given to the patient and to the family, and trust must be developed between the patient, family, and healthcare provider. The Hispanic families are all about trust and close relationships, so they feel that they need that with their healthcare providers. Religious beliefs. Catholicism is one of the most common religions in the Hispanic community. Catholic religion is typically traditional. It may include daily rituals, prayer, devotions, religious jewelry that is sacred. And why is this important to healthcare? Healthcare professionals may need to allow or advocate for certain rituals. They may need to allow time for them to pray, to do certain devotions. One time I had a patient that wanted to carry their crucifix with them to the OR, and we know that we can't have jewelry in the OR, so I tried to advocate for them to at least have it with them in their hand, and that was very important and really helped with their patient satisfaction and made them comfortable. Also, for example, they anoint the sick. It's a final sacrament. Family members may request to do this for the gravely ill or dying patient, and oftentimes hospitals will have resources for calling in someone that will be able to do this, or they could use their own priest, and to provide them with these resources makes them comfortable and allows their loved ones to die peacefully. Communication. The primary language in the Hispanic and Latino community is Spanish. Nonverbal communication traits of this culture are also very prominent. They include being close to one another, and friendly affection actions are common. They do a lot of hugging, a lot of touching, so many healthcare professionals aren't used to the family coming up and hugging them, but as we educate ourselves, we can be prepared. Direct eye contact may be seen as a sign of disrespect in this culture. So for example, a Spanish interpreter or the language line might be needed for effective assessment and development of a plan of care. Patients may invade our personal space, so we need to be prepared for that. If a patient isn't making eye contact, it may be out of respect for the healthcare provider. We can't automatically assume someone's being abused at home. It might be part of their culture. Lastly, health beliefs. Hispanics view health from a synergistic point of view, meaning that one's health involves the body, mind, and spirit. Folk healing is common in the Hispanic culture. It may be a patient's first choice to treat their medical condition rather than coming to a hospital. Folk medicine involves maintaining a balance between a hot and cold principle to sustain a healthy life. There are hot diseases and cold diseases. An example of a hot disease would be hypertension. An example of a considered cold disease would be pneumonia. And what they do is they have hot and cold remedies that combat these diseases. So if you have a hot disease, you use a cold remedy, and vice versa. Why is this important to healthcare? Awareness of these principles will give healthcare professionals an understanding of a patient's prior treatment, so why they might have done something different than what we normally would do to treat their needs. Educational needs and opportunities should be assessed by the healthcare provider. These patients may need additional explanations regarding the necessity of certain tests and procedures because they might not understand why they're getting some kind of test that might be considered a cold treatment or hot treatment, but we need to further explain why they're necessary for their well-being. And in conclusion, it's all about patient-centered care. As our country grows, cultural diversity is increasing in all areas of life, including healthcare. As professionals, we strive to provide the highest and most effective form of patient care. Cultural competence, sensitivity, and awareness are the keys to understanding and caring for these individuals. So as healthcare professionals and nurses and paramedics, we will be continuously being exposed to these culturally diverse patients and patient-centered care as we would like to be treated with our culture and have respect. We need to show respect for them, and we will be seeing a lot more of them. And thank you guys.